So hello guys, welcome back to the part 2 of this video of this exam, which is 2019 Krok exam, right? So let's start. So question number 26 is a patient with asphyxia, right? So he's unable to breathe, right? Unable to breathe. So after a brief respiratory arrest, developed a single infrequent respiration with passive expiration. So what I can feel is like he is just gasping for the air, right? Okay, after which he stopped breathing completely. So he developed what actually happened is, so he developed simple infrequent respiration. So okay, maybe like this with passive expiration. Okay, so maybe something like this, after which he's completely stopped breathing. So what type of respiration it is? So here we are totally able to observe what he was doing, some gasping respiration, right? Again, now let's look at some other option. Let's look for the chain stroke respiration. What is it, guys? So for this I have a beautiful graph for you guys. That is what this is here. See, chain stroke respiration, what is it? So slowly the patient will start increasing, right? So increasing, thereafter like on the peak here, thereafter it start decreasing, and it will happen in like as like a chain, right? So like this pattern will repeat itself, right? And for the like numerous of times. So that's what is known as the chain stroke respiration. Thereafter, guys, what is this is normal respiration. What is this? See, inspiration, thereafter it's followed by expiration. So it's like totally complete, like totally normal, and this is what we expect our patients to have, right? So thereafter, continuous inspiration. See, the patient is having this phase of the inspiration, thereafter he's holding the air, thereafter like after this phase he's expirating it, and which is very very low and definitive phase. So right, it's we can totally say that okay, this is a phase of continuous inspiration, right? So bites respiration, which is incomplete inspiration, okay, like little bit inspiration, thereafter expiration, expiration, thereafter a brief. So this is just like a chain stroke also, but like it's just like totally different patterns. Like we are able to observe, see this kind of patterns. That is what known as a bite respiration. And the last and the most important one is the casmal respiration. So here you will see the patient with the diabetes mellitus or the alcoholism, right? So just remember this thing, the casmal respiration is most commonly seen in the diabetes mellitus and the alcoholics person, right? After like they drink a lot of alcohol, thereafter they are just they are just breathing very very rapidly, right? So they are breathing rapidly, so they are doing like basically what the casmal respiration, right? Okay, let's move to another question. That is what a histological specimen demonstrates a vessel with the wall that consists of the endothelium. Okay, so like let me just make a basic diagram. So this may be a wall which is consist of this endothelium, right? Okay, let it be. What else? Basement membrane. So right, it's having some basement membrane also right here. Loose connective tissue, so it's not tight, so it's just like okay, it's a loose connective tissue, right? It's not that much stretched out, so it's what relaxed form, right? So what this vessel belongs to the following type. Remember guys, the lymph capillaries don't have the basement membrane, so it can't be lymph capillary, right? And second thing is there is nothing mentioned as something a muscular wall is also present, right? So muscular vein is itself not the answer, right? Thereafter, like what we are left with, the again the non-muscular vein, artery, and the hemocapillary, right? So for the hemocapillary, we must have the capillary is even sometimes the size of just endothelium, right? So it must not be having that much all the features. So that's why it can't be that option itself. So we are just left with the artery and the muscular vein again. So in the artery we are able to appreciate more what tight connective tissue, because artery itself is very, I would say, the complex space, because see, artery must be what thick, right? Arteries walls must be thick, so just to handle those like the high pressure, and also what it is, artery should also work as like the to maintain the pressure, right? to maintain what? To maintain pressure. So that's why it was must be thick also, right? So it's not even thick, like yeah, it's simple as the loose connective tissue with the, like it's not that much complex thing. So that's why I think the answer is the non-muscular vein, right? Next, right. A 45-year-old man with acute pneumonia is prescribed the penicillin antibiotic, right? That's what we do for the most of the cases itself. However, when they tested for the personal tolerance to his antibiotic, he developed an allergic response, right? Which can be possible because for the some people the penicillin is what? Very allergic. Penicillin is what? Very allergic, right? So you must ask your patient before giving any kind of medicine, sir or madam, to have any kind of allergies or something, right? So he developed an allergic response. What drug should be prescribed to treatment instead? So just remember guys, if he is having the problem with the penicillin, right? So we must not give the penicillin. That is it. So no penicillin, no penicillin, no penicillin, right? Thereafter we are left with the what? Ciprofloxacin, which is the category of fluoroquinolones, right? Fluoroquinolones, right? Thereafter what? Erythromycin is itself a category of what? Macrolides, right? So then, like the second drug of choice for the treatment of pneumonia, that is what it is? Erythromycin out here itself. That is it. Because like we just must prescribe the treatment according to the regime, right? So that is what it is. It must be macrolides out here, right? Next one. During diabetes mellitus and the starvation, number of ketone bodies in the blood increases. The bodies are used as a source of the energy and are synthesized from the following substances. So the answer must be acetyl coenzyme A. Why guys? See, just think it as this way guys, okay? So the triacylglycerol, which is what? Fats. It gets broken down into the acetyl CoA, and finally this is used for the production of ketone bodies, right? So what is the source of the ketone bodies? That is acetyl coenzyme A. That is it, right? And what else should I tell you about it? See guys, if you want to just know the whole process, then it's like itself a very complicated process out there, but for the sake of this question, just think it as this way, okay? If there is a like destruction, okay, or the I would like the better word is the beta oxidation of the fatty acid, right? Then it will automatically like that will lead to the production of ketone bodies. That is it guys. Just always remember this thing. If there is no ketone body production even at the starvation, then the patient must be having some problem with his metabolism of the fats, right? Okay, so next question. So the bacterial, again this is a microbiology question. Okay, so what are the key points out here? Bacteriological laboratory needs to prepare for analysis of materials that are suspected to be contaminated with the spores of anthrax, right? And where is the anthrax found the most, guys? If you can tell me. That is what? That is in the soil, right? And sometimes like people used to refer it, okay, don't go to that place, it is like whoever goes there will not come back, right? No, like don't build a house on there, don't just pet your animals out there. So sometimes sometimes the reason can be due to anthrax also, right? So some people say that soil is very bad, oh my god, don't go there, right? Or don't live out there, that the whole village is like totally abandoned just due to that problem. So sometimes it happens just like that. So the anthrax can be a causative agent for that, right? So what is the diagnostic preparation allows for the quick detection of these spores? See guys, what happen is out here, like the answer is simply the anti-anthrax fluorescent serum. So the I will say the anthrax, right? So like that's a simple directly a microbiology question itself, right? So the spores of the anthrax can be seen with the anti-anthrax fluorescent serum. What will happen, like the antibodies get attached to this anthrax thing or the anthrax spores, and it will show in the fluorescent light, okay, because these are the radioactive material itself. So it will show in the fluorescent light, okay, that this thing is present out here, right? So this is the diagnostic measure for the for the anthrax. Okay, next point. The next question, 31st, is Sichnov has proven that a tired limb restores its working capacity faster if during its period of rest another limb works. Okay, it becomes a biased concept of that is the like this is even the definition, right? This is the definition of the term active rest. That is it, guys. You need to remember this definition. Like that's not even that much complex definition it is, right? So the one limb is in the rest stage, another limb is in the active stage, right? So that's how I used to remember this thing. So it must be rest with the activeness. So it must be what? Active rest, right? Okay. So the patient is obliterating and arthritis, has undergone ganglion sympathectomy. Positive therapeutic effect of his surgery is associated with the development of arterial hyperemia. That is what happened, guys, in the clinical practice also of the lower limbs, which can be described as. So just think it in this way, guys. Like so, there may be a nerve is passing by. Okay, so the person did what? Like the surgeon is ligated just this nerve. Okay, or like just that is the best way I can describe it as. Or just think like okay, there is a ganglion out there. It gets what? It gets cut it out by the surgeon, right? So what is the process which took place here? That is what? Neuroparalytic process. That is it, guys. Again, this is a direct I would say word of the physiology which you need to remember. If there is any see what happen is like if there is due to there is due to some physical stress, or maybe like there is some time due to nerve compression, right? Any limb is having that kind of effect, so that is neurotonic, right? But if the surgeon totally like gated out the whole ganglion of that, like the ganglion, right? The best example is about the as I described about the nerve, right? You can just think it in that way. That is even more better. So right, that is what? That's neuroparalytic effect itself. Okay, next question. Patient has been suffering from the bronchial asthma. What is bronchial asthma, guys? It's a type, which one? Type 1 hypersensitivity reaction. And what will happen in the if there is a chronic phase of the asthma, right? So there is chronic phase of asthma. So there is what? Eosinophilia itself. Right. So just think it in this way, guys. Like there is some reactive reaction out there, which there is some reaction going on. So what will come the first? That is what? Neutrophils, right? But what will remain till the last? That is what? Eosinophils. So it will come in the last. But as it is itself, so you can see like it's a 15-year process, right? So long. So there must be some presence of some eosinophils. That is it. Okay. Next one. A student whose educational achievements throughout the semester were poor, okay, feels emotionally tense during the final test. So that's what happened, guys. If you don't study for the semester, you will feel tense during the test, right? So what is the primary case of that induced? The leading mechanism of the emotional tension of this case. Okay, so lack of energy and information. Okay, so lack of the time. No, there is plenty of time. Okay, lack of energy. No, maybe he has okay, so there is nothing about the energy which I can say. Lack of energy and information. No. Lack of time and energy. No. So there is just what? Lack of information. Why? Because he has not studied for the whole semester, right? What do you expect him to write in the exam, right? So that is what? That's simply the lack of information, right? Okay. Next question is if a 30-year-old woman developed facial edema. Again, guys, as we just talked in the another video, what is the mechanism of the edema? Just think it in this two way. Okay, either increased hydrostatic pressure or decreased oncotic pressure, right? Easy one, right? Okay. Now the examination detected proteinuria. So there is a protein in the urine which is 5.87 gram per liter, guys. So now we have a term out here, 5.87 gram per liter. Thereafter hypoproteinemia, so there is less protein in the blood, which can be itself I would say common sense thing, because see, if there is more excretion of the protein, so there must be less protein inside the body, right? Okay, what next we have? There's dysproteinemia, okay, hyperlipidemia, okay, so there are more lipids now present in the blood just to compensate. So such combinations are another characteristic of, see guys, what you need to see here, that is this point. Which one? First of all, he is having what? Proteinuria. Thereafter, like, okay, which is this one. And remember guys, for whenever we talk about the kidney problem, so we have the two parts, right? Nephritic and nephrotic. Okay, so what is the nephritic and nephrotic? If the protein loss from the urine is less than, okay, it's less than about 3.5 gram per liter. Why I said 3.5? Because in some sources it's written as 3, in some books it's written as 3.7. So just to be on a safe ground, I just say okay, 3.5 gram per liter. Let it be. If it's less than 3.5 gram per liter, then it's the nephritic syndrome, and if it's more than 3.5 gram per liter, right? In what, guys? That's important, in urine, right? So we have our, okay, so it's chronic kidney failure. Well, if in that, see guys, in the chronic kidney failure case, those there are a lot of like numerous of the symptoms which must be having. So the patient must be having elevated urea, thereafter creatine, thereafter a lot of things, right? Another, which is what, acute kidney failure. No, the patient is having this condition, like if she even developed like the facial edemas, it must be having like some long process, right? So long process, which I mean is minimum more than 15 days. Let it be, right? Let it be just more than 15 days. But still, like in the acute kidney failure, there must be a lot of symptoms. See guys, what can be a case of acute kidney failure? Just think about it, okay? So there must be, maybe some drugs can be present, maybe some radiation zone or something, but still, like, there is no history about that. We don't have enough history to conclude the acute kidney failure. Chronic pyelonephritis, well, no, if that is the case, there must be some WBC cast which must be present inside the urine, right? So there can also be no, there can be the sensor. There again, we are on the nephritic syndrome, and nephritic syndrome we can conclude when the urine protein concentration must be less than how much? 3.5 gram per liter. Perfect, right? We just had this one. Easy. A 45-year-old woman, okay, exhibits no sign of diabetes mellitus. Okay, so like she's not having diabetes mellitus, but her fasting blood glucose are elevated to 72 millimole per liter, guys. So oh my god, that much. So 72 millimole per liter. So what do you think, guys? What should we do? Like, just think it in this way, guys. Maybe she just ate a lot of, like a lot of what? Glucose, right? We can just think it in this way. Maybe that can be possible, or maybe we just need to test her for the diabetes mellitus. And what is the best, or I would say the gold standard test for the diabetes mellitus? That is what? HbA1c. That is what your glycated hemoglobin test. Okay guys, so that's why it's your answer is the glycated hemoglobin, right? Again, thereafter, let's see the some other options. What does it say? First is glucose tolerance test. Well, we must like wait for that, right? If we will check, if we will talk about the OGTT test, right? So oral glucose tolerance test, we must wait for that. It must take some time. So we just don't have that much time, right? Blood urea, no, we don't need to check the blood urea. Why we need to check blood urea? Maybe that can be maybe due to some I would say liver pathology, it may be possible, right? Or the kidney pathology. Residual blood nitrogen, well, no, not even the perfect answer. Well, why should we, right? Urine glucose, well, we can check that, right? We can check that, but that's not the first line, right? That's not the first line. Okay, so what we should do, we must check the glycated hemoglobin. And just for you guys, because this thing will not show up in the group, but just for your information, I just wrote it like, what is the another name for the glycated hemoglobin? That is HbA1c. Okay guys, great. Let's just proceed further. Okay, examination of a patient shows decreased leukocyte and erythrocyte and low hemoglobin level in the peripheral blood. So what I can suspect here, first of all, if there is a less hemoglobin, so what is the less? Okay, what is the less hemoglobin is called as what? Anemia, right? Anemia. So there is anemia present out here. Okay, and its appearance of large cells. Oh my god. Now I have my answer inside my mind. What is that? See, guys. Whenever I talk about the megalocytes. Megalocytes. What does it mean, megalocytes itself? So there is a large number. Oh, sorry, there is large size of RBC, right? Or there is big size. So what can be reason of this? Only two reason can be present, guys. Either it's vitamin B9 deficiency or either vitamin B12 deficiency. And for all of you guys who are watching this video, just tell me what is the name of vitamin B9 and vitamin B12. Okay, so the name of vitamin B9 is what? Your folate. And what is the name of vitamin B12? That's you need to comment, comment down in the comment section. Let me just see. Okay, right. So what vitamin deficiency can cause this clinical presentation? We just landed on these two vitamins, right? Again, riboflavin. Which is the riboflavin, guys? Which vitamin is it? Again, if you can just do it in the comment box, I will really appreciate that. Okay, riboflavin. Okay, now we have our answer. That is vitamin, which one? Folic acid. Which is which vitamin, guys? Vitamin B9. Remember. Thereafter, okay, the biotin is what vitamin, guys? So that's vitamin B7, niacin, vitamin B3, vitamin C, right? And let me just give you, like a brief, not actually brief, I just give you a superficial idea what will happen. Like if the either of these vitamin is not present, okay, ascorbic acid, that's what ascorbic acid or the vitamin C is basically needed for the production of the collagen, right? So if there is less collagen synthesis, there must be some delay in the bone healing, right? That's completely understood itself. Niacin, guys, niacin itself plays a role. For example, it's itself a energy containing molecule or the electron containing molecule. So the niacin itself is maybe seen its form as the NAD, right? So NAD is itself a form of electron carrier form, right? So that's why niacin is important. Thereafter, biotin is used for the lot of like it's a cofactor for lot of reaction inside our body. So that's why biotin is also important. Riboflavin, we can say colitis. That is the, I would say, the reddishness, or like I would say cherish reddishness near your lips, right, on the periphery of lips. That is it. Okay, next question. Right. What changes can be expected to occur to an isolated heart of a toad if excessive amount of calcium chloride is introduced into the periphery? See, guys, what we are basically giving, that's the calcium, and the calcium is causing what? Contraction, right? And if it's contraction, it must be more frequent also, right? More frequent contraction itself. And if it's an the cardiomyocyte, or if it's the heart cell, it must be having this contraction again and again, right? So let's just see the options again. Increase cardiac contraction force. See, guys, whenever cardiomyocytes contract, it contracts at its best, right? So undoubtedly this answer is right, but slightly like not according to the point. So let me just make it a single tick out here. Diastolic cardiac arrest, no, it can't be possible with this case. Maybe this is possible with the hyperkalemia case, right? Thereafter, the another one is a decreased cardiac contraction force. Why should it happen? No, it should never happen if we are giving what? Calcium. Calcium must be what? Increasing the force, right? Increased cardiac contraction frequency. Oh, that's true. It must be doing that. So again guys, now you know the answer how, because see, it's increasing the force as well as the frequency. So what must be the answer? Increased cardiac contraction force and frequency, right? Okay, okay. Thereafter, on the another question, we have this question, that is a newborn present with a weak suckling. Okay, like the his suckling is weak. What is suckling, guys? Suckling is like this drinking of the milk from the mother's breast. That's known as what? Suckling, right? Okay, guys, and thereafter, like what the guys also babies also having, that is vomiting and hypotonia. Okay, blood vomiting and hypotonia, blood and urine citrulline are very high. Okay, so now we okay now we are having this like in the laboratory marker, that's the citrulline is very high, right? Is high. And what like metabolic process is disturbed out here? See guys, like let's just take a minute and just think about it, because see, now the answer is in front of your eyes, but like you must know the answer out here. So I'm just giving you a few seconds. Okay guys, then let's just see the options out here. That is, first of all, that's the glycolysis. If the glycolysis is disturbed, guys, well, then it must be like the glucose must be accumulated first of all itself, right? So there is nothing like that, so only the citrulline is high, right? The another one is the Tca cycle. If the Tca cycle is inhibited, then there is increased amount of what? Acetyl CoA something, right? Or there must be like excretion of the pyruvate, you know. Okay, thereafter gluconeogenesis. So if there is no gluconeogenesis, well, there is if you will like if you can just use some common sense about it, for the newborn, for example, it doesn't even need gluconeogenesis itself. Why? If you like, somebody can type the answer inside the comment box, I will be really happy. The Cori cycle itself, no, it's not even the perfect answer, right? So the Coric acid cycle is itself the relating the two processes out there. Which two processes, if you can comment, because this is the question which I want you to understand, because it's a, I would say, a very important question. If you can just comment in the comment box, I will be really happy to see that. But still, for like the question we are having, the urine citrulline is very high, and see, citrulline is a compound which is synthesized in the ornithine cycle, right? And what is the another name of the ornithine cycle? That is your urea cycle. Okay, you got the point, right? So that is what urea cycle is. Okay, next one. Patient is taking aspirin. Aspirin is itself what? COX-2 blocker. Okay, with this drug inhibitors instead of platelet degradation activator thromboxanes A2. Okay, that's what we know, right? That's what its mechanism of action is. What substance is the activator synthesized form? Okay, so like the question is asking like what substance is the activator synthesized form. So we all like the first, what will happen, like the arachidonic acid. Right? So that is the parent of all these things, right? So that must be the answer. Fractonic acid, again the homogenistic acid, it's again the biochemistry. It can be elevated due to the vitamin B12 deficiency, right? Acetic acid, no. Well, why should the acetic acid itself doesn't make any sense out here? Acetic acid, is present in the B string or something. Glutamic acid, no, it must be present in the again some by other biochemical processes. Malonic acid, again guys, this itself doesn't even feel right? So only and only option will, like, see, the only option, like these are not even the near these options. Why should this kind of acid this is just like the acid is the only word which may confuse you, I feel, because in the pharmacology, I think these are the only little bit of the acids which are the derivatives of this, cox. Like, see, arachidonic acid, right? It gets broken down by the cox to form what? Prostaglandins, right? So that is what it is. That's it. Disease of small intestine lead to the changes of quantitative ratio between the mucosal epithelial cells, but cell types are normally predominant in the cryptal epithelium of the large intestine. Again, guys, so the which is the most abundant kind of cell inside our intestine, that itself is the goblet cells, right? Sometimes it may also refer as the mucinous cells in some books. So, well, this is again a straightforward question out there like this, and I would say this is even also an straightforward question. Just remember as what? Aspirin, or the, I would say the most of the NSAIDs, right? These are just the blocker of COX-2, or the COX blocker, right? That's even better word to say. So these are what? COX blockers. Okay, let's move further. The parents with normal hearing. Okay, so there may be some trait. For example, this is female, this is male. Okay, what they are having? 2 daughters and a son who are congenitally deaf. So they are having what? 2 daughters and a son which are congenitally deaf, right? And what, their other 5 children are healthy. Oh my god. Okay, let me just make some in a random way, right? 1 2 3 4, and thereafter last 5. So this may be healthy. So now we can just rule out something, that is, first, if it's not X-linked recessive, it's not Y-linked recessive, right? It's not even Y-linked dominant, right? It's not even X-linked dominant. It's not even autosomal dominant. Why we should say this? See, for the X-linked dominant, there must be what? Mother must be affected. So there is mother is not affected out here, right? Y-linked, the father must be affected out there. No. X-linked recessive, maybe mother is the carrier, but there must be sons must be more affected in this way. So but there are a lot of sons which are completely fine, so not possible. Autosomal dominant, all must be affected. What is left? Autosomal recessive, right? Itself, because it's passing generation without affecting, right? So that itself can be understood as autosomal recessive way. Got it? Okay, so disturbed activity of trypsin and chymotrypsin lead to a disturbed protein breakup in the small intestine. Activity of these enzymes depend on the presence of the following factor. That is again, that's the direct answer, guys. That's the enterokinase, right? So this is a direct answer question. That enterokinase is the answer out here, because the entrum, or I would say the intestines, we're having the enzyme enterokinase, which are breaking, or we're these enzymes are dependent on this factor, right? So here I have a beautiful diagram for you guys, which a 30-year-old man with an incised wound on the plantar surface of the left foot was brought to a dermatological department. Lifting on the lateral side of the foot is limited. So this kind of movement is limited out here, but muscle is most likely to be the disturbed, right? See, maybe the muscle maybe this, or this way it's affected out, right, on the plantar surface. So as I just showed you out here, the peroneus longus muscle, right, it is responsible for the the adduction of foot on this side, right? That is it, guys. That's the only answer, which maybe seems logical also, because soleus muscles, okay, it may be present out here, something like this. Okay, it's even the calf's muscle, so it's connected with with the Achilles tendon to out here. Okay, so that's not with the answer. Anterior tibial muscle, which is about right here, or I would say on the posterior side of something like here, right? It may be possible like maybe something right here, but again it's not for the lateral movement of your leg, right? It can't be present out here like that. Thereafter, right, let's move to the next question. That is what. So there are a lot of indexes out here, but let me like, if whenever you get these kind of questions, I would say like, just first of all look at the last line. What does the questioner, what is the examiner, right? Examiner trying to ask you first of all. Okay, this clinical presentation indicates the following blood pathology. So he is asking about some blood pathology. We are having like what? Hemolytic anemia of the newborn may be present. Okay, hypoplastic anemia, acute myeloleukemia, undifferentiated leukemia, or chronic myeloleukemia. Right. So the hemolytic anemia, it can be present in what case, guys? It can be present in the case of malaria, maybe, right? And if there is hemolytic anemia, it must be what? Must be increase of the unconjugated bilirubin. Right, that's itself the marker of the hemolytic anemia. Right? Thereafter, guys, hypoplastic anemia, maybe there can be some drugs which can cause some kind of anemia that can be related to the hypoplastic anemia. But okay, so let me just take a belief about here. Acute myeloleukemia may be present. For this, we must check out the myelocytes or the myeloid cells. Undifferentiated leukemia, okay, like if nothing of the like, none of this can be verified from our investigation, then we can just directly tick on our undifferentiated leukemia, right? Okay, guys, then let's start looking on this indexes. Okay, blood index is completely filled, like about to be fine. Platelets, okay. Reticulocytes is also present, which is also in the normal amounts. Leukocytes is okay, it's elevated. Thereafter, stab neutrophils is only about 20%, and the segmented neutrophils is also decreased because it must be about like near to the 55%, right? Lymphocyte 5%, monocyte 5%, right? And always remember, guys, one more thing. For the chronic myeloleukemia, or like I would say for the acute myeloleukemia, the blast cell must be about 10 to 90% of the AML. So there is nothing like this, right? So that's why I think we can conclude the answer to the chronic myeloleukemia. Just think about this thing, guys, because this itself being a very like big question itself. So sometimes like people get even, I would say, confused in this kind of question. But just, guys, see like what is the question related to. Okay, first of all, the anemia. For the to rule out the anemia, what you should check first of all, okay, you should check the hemoglobin. Okay, there is maybe a little bit of anemia is present. Hemolytic or hypoplastic. For just like check the bilirubin index or something, there is not even given the bilirubin index, right? Hypoplastic anemia, there is no history of drug taking or something. Acute or chronic myeloleukemia, thereafter undifferentiated. See, there is leukemia, but there can also be like this kind of markers given out directly. So there are like directly it's given as, see, myelocytes is about 5%, right? So there can be some, I would directly say, myeloid leukemia, but which it is, it acute or chronic, it must be differentiated by this point, which is the blast cells should be about 10 to 90%, right? So if you see about the blast cells, what are the blast cells? These are the I would say pre-stage of the neutrophils. So if it's the 10 or to the it's about, if it's about 10 to the 90%, it's for the acute myeloblastic leukemia, right? So there is nothing even given like that, so I can just trick on the chronic myeloleukemia. Perfect. Okay, next question. 3-year-old with the elevated body temperature has taken aspirin and developed increased hemolysis of the erythrocytes. See, guys, that's a classic presentation of G6PD deficiency. Glucose 6-phosphatase dehydrogenase deficiency, guys. So okay, in case hemolytic anemia is happening, be caused by the congenital deficiency of the following enzyme. That's your perfect, right? Next question. Patient has diphtheria, peeling blood against the background of acute drop in the body temperature and tachycardia. So endotoxic shock is happening. No, not endotoxic shock, guys. Maybe some endotoxins are getting secreted by this diphtheria. So peak of the day is against background of acute drop of body temperature. So the temperature is getting dropped, and tachycardia is having. The blood pressure is 70/50 is having. So there is what decrease of pressure out here. What type of vascular tone is it? It's very easy, guys. This is what hypotension. So what is it like? It's acute hypotension. Essential hypotension can't be happening because there must be some another, there must be some I would say the mechanical reason what must be happening for that. Somatoform autonomic dysfunction. So is there anything wrong with our nervous system? No. Chronic hypotension, no, he's just having because of that diphtheria. It must be about 3 to 4 days maximum. So there it can't be chronic, right? It can only be acute hypotension. Patient with elevated blood pressure due to increased vascular tone. Always remember, guys, in the vessels what receptor you are having, that is what alpha 1 and beta 2. Alpha is for contraction, beta is for relaxation. If it gets stimulated, it will contract. If the beta gets stimulated, it will relax. So maybe there is possible, but if it's the increased vascular tone out here, see, if there is some increased vascular tone out here, what can be happening? Maybe alpha is acting more. To lower the blood pressure, in this case, it is necessary to prescribe the blocker of what? Muscarinic. No need. Alpha and beta, I don't know. If we will block the both alpha and beta, what will happen? Nothing, guys. Why? Because see, beta, if for example, if it's trying to do some work, maybe it's like just trying to open up the vessels, right? It may be trying to decrease the pressure of the blood out there. It will also stop working in that way. So we'll not trying to give that, right? We will not try to we will not try to even block the beta. Again, histamine, no use. What is remaining? Alpha, right? So if we will block the contraction, what will be there will be relaxation. And if there is relaxation of the vessel, what will happen? It will be hypotension, right? So what is the treatment of hypertension? We all know that it's the hypotension. That is it. Not that much hypotension again, so that the patient will collapse and it will have some vertigo, but still you get the point, right? For example, if the patient is having the blood pressure say 160, say about 160, we must normalize it about about to 120, right? I'm talking about the systolic out here, right? What next? We have collagenosis. Patient typically present with the processes of the connective tissue destruction. Presence of these processes can be confirmed by the increase in, see guys, these are the guys, I will say proline and lysine, right? So this is the important for the synthesis of collagen according to the biochemistry. Okay, thereafter transamine is like creatine and creatine, there is nothing wrong with the mitochondria or the liver or the kidney, sorry. Blood urates, nothing, guys. Again, the collagen is typical for what? Wound healing, right? That is the important point for me. Wound healing. So transaminase activity of blood. Why should again creatine no IDH or the LDH isoenzyme? Only and only this is this even seems logical. None of the other options seems even logical also, right? So finally we are on the last question for today, right? Now see what happened here is a 34-year-old man died in a comatose stage. So the man is died in a coma. Oh my god. According to his family, after a business trip to an African country, right? So see guys, there are some diseases which are present just in some part of the world, right? So for example, there are some diseases which are just present in the, I would say in the India, for example, in Africa, right? In, I would say maybe just like this, maybe some Mediterranean countries, right? or the Gulf countries, so they are just like that. So in the Africa, just think more about the Ebola and more about what the waterborne diseases, or the waterborne, I would say the mosquito-borne diseases, right? Mosquito. So if you will think in this way, right, we'll just not get any conclusion, but let's just see what will happen. That jaundice is happening again with, I just discussed with you guys above. Maybe the malaria will cause what, hemolytic anemia. That is an important point for me. Autopsy shows the dense enlarged spleen. It must be showing why. See, dense enlarged spleen with slate black pulp. If the RBC is getting restricted, their dead bodies or the RBC are getting, are getting filled inside the spleen, right? Enlarged pleiothoric liver, hepatomegaly, and splenomegaly is seen. Gray bracon section for the same reason. Cerebral gray matter is brown gray. Again, guys, again due to the destruction of the RBCs. Cerebral white matter contains numerous small hemorrhages. Okay, what infection disease can be suspected? That's none other than malaria, right? So here for this question, we just have our two keywords, right? And what you should remember about this. First of all, the patient traveled to an African country. Thereafter, he started having some jaundice attacks, right? And last spleen, and with the what? With the hepatomegaly itself, right? Here it is in last plethoric. Cerebral gray matter is brown gray. So you can also classify it as the cerebral stage of the malaria, right? So thank you guys for if you stayed this long, and I hope you guys success, and I sure no, I will make sure that I will just take this other 50 question, right, anytime soon. Maybe I'm just trying, I will just try to post this video tomorrow if possible. So thank you guys, and have a good night. Bye bye.